Hello and welcome to your Pharmacology Clear and Simple ALH3 lecture on Chapter 16, Cardiovascular System Medications. Hoping that this lecture combined with couple weeks back when you did your EKG in your ALH4 and looked at the cardiovascular system there. I'm hoping that some of these things will make sense when you couple them with all the information. Usually this is when the brain kind of ties some things together. So objectives for this lecture are to define all key terms, discuss how the cardiovascular system functions, and describe 10 categories of cardiovascular medications and their uses and functions. Let's look first at the cardiovascular system. So the heart is made up of 4 chambers, the left and the right atriums and the left and the right ventricles. These chambers continuously contract and relax in a coordinated rhythm to send blood out to the lungs via the pulmonary arteries to obtain oxygen. This oxygen-rich blood is returned to the heart via the pulmonary veins and is then sent out to the upper and lower parts of the body via the aorta, which subdivides into a system of arteries. And then finally, the blood, which is now depleted of oxygen and rich in carbon dioxide, returns from the body to the heart via a network of veins where it again is pumped to the lungs to exchange the carbon dioxide for more oxygen. This cardiac cycle delivers nutrients such as oxygen, hormones, and immune and clotting factors to every part of the body, including the heart, and it carries waste products such as carbon dioxide out of the cells. So again, looking here, our heart is amazing, and this is why you've had anatomy and physiology as a prereq, because this should be something that you've already kind of learned and at least have that basic knowledge of how that works. So the arteries, again, have the oxygenated blood sent to the body via the aorta and smaller arteries, and the veins have the oxygen-depleted blood rich in CO2, and this is returned to the heart via the veins to repeat this cycle, as we said in the last slide. So the major roles of the cardiovascular system are to deliver nutrients such as oxygen, hormones, and immune and clotting factors to the body, and also to carry waste product, the CO2, out of the cells. So here we're talking about cardiovascular system medications, and these can increase the heart rate, slow the heart rate, make the heart function more effectively, or make it less irritable. In addition, medications may be given to make the environment in which the heart functions a less hostile environment. So as we go through this and talk about the different types of medications, those are all the roles of the medications on the cardiovascular system. So looking at myocardial infarction, stroke, and clotting. So damage occurs to the heart, brain, and lungs due to impeded blood flow. Chest pain may be a symptom of anoxia, and this is total lack of oxygen. Hypoxia, which is significantly reduced oxygen. And if untreated chest pain goes on, it may lead to ischemia, which is tissue injury, or infarction, which is actual tissue death. So myocardial infarctions, strokes, which are the CVA. So MI is myocardial infarction. And for strokes, it's CVA, the cerebrovascular accident. So myocardial infarctions, MAs, or stroke, the CVA, and clots all result in damage when blood flow and thus oxygen is impeded to the chest, brain, lungs, and other organs. Medications to prevent this deficit of oxygen can be prescribed to prevent MI and CVA. Anti-anginal medications dilate arteries and veins, thus increasing the blood flow to the heart. Anticoagulants prevent blood flow from clotting. And antiplatelets prevent platelets from clumping up to form the clots, and thrombolytics dissolve clots that have already formed and can prevent the CVAs and MIs. A lot of information there. Okay, so these cardiovascular medications function by increasing the heart rate, slowing the heart rate, making the heart functions more efficiently, making the heart less irritable, and making the environment less hostile for the heart to function. So an example of less hostile is the way we use diuretics and making it less hostile in the body. Let's look at comprehension checkpoint 1. Cardiovascular system medications work all of the following ways except. You are correct if you selected C, makes the heart less sensitive, not more sensitive. So if you said making the heart tissue more sensitive, that was incorrect because it actually makes the heart less sensitive. Looking now at anti-anginal medications. So angina pectoris is chest pain caused by lack of oxygen reaching the heart. And for the medications, they use the vasodilators. It dilates the arteries and the veins. Some examples, so we're talking about nitroglycerin, and some of those are nitrolingual, nitroquick, nitrostat, and nitrodur. These are given sublingual, buccal, or intravenously in the routes, or transdermally to treat and prevent angina. So the most common route is the sublingual, and every 5 minutes for a maximum of 3 times. If pain persists, EMS should be called. Anticoagulants, examples warfarin, so Coumadin, heparin are some of them, Levinox, and antiplatelets. These prevent clot formations by interrupting production of cofactors that help in the clotting process. Users of heparin and Levinox are given as subcutaneous injections in patients at risk for developing deep vein thrombosis, DVT, and Coumadin is given orally. Patients are at risk for bleeding, and so it's important that the patient reports that they are taking these medications, especially if you've gone in for surgery. They always ask you if you're taking any, and they usually ask for the patient to stop taking it for 7 to 10 days prior to a major surgery. So the antiplatelet medications prevent platelets from clumping together to form clots. Aspirin would be an example of this, and aspirin is over the counter. Patient education for those taking the anticoagulants and the antiplatelet medications is very important. Patients need to learn the signs of bleeding and the precautions to take for safety. Dietary changes to avoid foods that can interfere with anticoagulant therapy are needed, and frequent blood tests are required to monitor drug levels and also clotting times. More antiplatelet medications include adenosine diphosphate as well as Plavix, and these prevent clots from forming and provide long-term prevention against clot formations. We also have the glycoprotein 2B and 3A inhibitors, and these prevent enzymes that aggregate platelets from working. It's given prior to surgery to prevent the clots. And RioPro would be an example of this, or Aggrastat. Again, we just talked about patient education, but it's important for patients to get the proper patient teachings on this, learn signs of bleeding and precautions, and avoid foods high in vitamin K, such as cabbage, cauliflower, spinach, and other leafy green vegetables, also cereals and soybeans. Looking now briefly at thrombolytic medications, these can dissolve blood clots. Thrombus is a clot in the blood vessel, and an embolus is a clot that breaks loose and travels. This can cause myocardial infarction, CVAs, or pulmonary embolus. Frequent testing is required to monitor clotting times. So we have the PT, or the prothrombin time, and this is to evaluate the ability of blood to clot, and this is done before surgery. Then we have the APTT, or the activated partial thromboplastin time, and that is to evaluate heparin therapy. We also have the international normalized ratio, and this is to evaluate how long it takes blood to clot, and it's primarily on patients taking Coumadin. Antifibrinolytic medications help to form clots when the patient is hemorrhaging. Blood loss can also be treated with other hemostatic drugs, such as vitamin K, which is required for clotting and is used as an antidote for anticoagulant overdose. Patients suffering from hemophilia require medicating with a naturally occurring hormone, DDAVP, which rises the levels of the factor VIII and von Willebrand factor, reducing the need for administration of blood products. Let's look now at comprehension checkpoint number 2. The antiplatelet medication showing promise in survival rates for MI patients is the antiplatelet medication showing promise in survival rates for MI patients is, and I'm going to tell you this one. It is aspirin, and this is showing promise in survival rates of MI patients. So simple aspirin, which is over the counter, it's showing that when taken, when symptoms appear, that it can increase the survival rate. In addition, it is showing promise in preventing subsequent heart attacks. We're going to end here and start a new slide for the next part, for part 2 of the lecture.